Good morning. Let's do a quick pharmacology review. So, looking at what pharmacology is, so just our properties and effects of drugs and medications on the body. So, how it's going to affect our patients. The drugs themselves are just those substances that produce a physiological effect, whether therapeutic or not. So, that medication is a chemical substance that is used to treat and prevent disease and relieve pain. As we get into the different components of a drug profile, these are the things that we've already talked about you need to know. So, where do we find those? Do I have them all to memory? No, but I know where my resources are. So, what are the drug names? So, our generic name, our trade name, and our chemical name. I don't know about y'all, but I can't say the chemical names. So I go to my physicians, my pharmacists, just like, hey, what is this? What is this name? And then they'll usually give you either that generic or that trade name. Helping people understand that Tylenol and acetaminophen are the same things. For my dad, we used to have to actually put ibuprofen in the Motrin bottle because he would not take ibuprofen. It's not the same thing. Well, it's technically does not look the same, but the ingredients are the same. So I think we've come a long way over the past several years, but sometimes you may have to educate your patient just to help them understand it's the exact same drug. One's just cheaper than the other. Now, you will occasionally have patients that they'll tell you, I can't take the generic. And that's usually they know. They've taken a generic. It doesn't work for them. It doesn't have the same effects. So, okay. Our classifications of drugs. So, what type of drug is this? And what is it being used for? So as we look at classes of drugs, a lot of times we look at what body parts are they, or what body areas are they working on? Is it working on the respiratory? Is it working on cardiac? Is it working on hypertension, diabetes? So we'll break that down into these different medications classifications. Our mechanisms of action. So how does the drug work? What is the intended purpose for the drug? And I'm going to add one little piece here on your mechanism of action. What protocol? What protocol does it fall into? So is this patient having an allergic reaction? That's my mechanism of action of I want to reverse their anaphylaxis. They're hypoglycemic, so I want to, that mechanism of action is hypoglycemia. I need to reverse it. Indications. What are our reasons for taking this drug? So hopefully I'm taking the drug to increase their blood sugar, open an airway, increase or decrease a heart rate. So whatever you're looking to do, increase or decrease the blood pressure. I'm working on those pieces of the body. Why is it contraindicated? So what is that contraindication? When should you not give the drug? Obviously, if we have a known allergy, that's a given. Those are end-all be-alls. Stop right there. Not going to give it. But sometimes patients will tell you that they are allergic to it when it's actually just a side effect. So listen to your patient. Well, tell me what it does to you. What breaks me out in hives? Okay, definitely contraindicated. Or it upsets my stomach. Well, it's aspirin, it's Tylenol. If you take it long term, it's going to do that. It irritates the stomach lining. Right now, while you're having your heart attack, I want to try to work on those platelets a little bit. And let's go ahead and take the aspirin. It one time won't hurt you. Then pharmacokinetics. How is the drug absorbed, metabolized, and so forth? And then what is its half-life? So when should I expect to see it start working? 30 minutes, 30 seconds. So different medications are going to work at different times. So I need to know, is this quick acting? Is it slow acting? Also, how do, taking that a little bit step further of how do I give it? Do I give it fast or do I give it slow? Or are they giving it, if I'm administering it IV, if they're absorbing it through the GI tract, so we give it by mouth, then, how is their system work? So when we get into our special populations of our infants, children, our geriatrics, their GI tract is a little slower, so they don't metabolize it like you and I do. So it may take a little bit longer. What are our side and adverse effects? Are there any side effects? Are there any adverse effects? So what kind of things have we seen that may happen with patients? So with our fentanyl, morphine, we know that sometimes they'll start itching just a little bit right here, especially if you give it too fast, so you want to give it slow. That's a side effect. Now, they break out in hives, and that's going to be that adverse reaction. Our routes, how is our medication given? So we've already talked a little bit of by mouth, PO, IV, IO, IM, sub-Q, all the different ways we can administer our medications. Sublingual, buccal, inside the jaw, rectal. Don't do that often. You'll see that more in the hospital or nursing home. Dosages. So what are the dosages? You're going to see dosing ranges when you read most of your material. What gives us our dosage is, number one, what our medical director wants us to give. If you look at the state protocol, state medical directors got together and said, this is where we're looking at. This is probably the best dosing. Sometimes you'll still see a little bit of a range, but it's not as much as you would in your different drug books that you'll look medications up in. But the end-all be-all is going to be our county protocols. So whatever our county medical director tells us, that's what I'm going to give. And it may differ from one county to the other. One physician's seen it work better at this dose, one's seen it work better at this dose. Special considerations, as I've talked about, my geriatric, pediatric, pregnant patients. So can I even give it to my pregnant patient? And we'll talk about this in a little bit as well. And then other information. So the drug profile may include any other information that is vital about the user. So, this person's had this happen. It's not typical, but listen to your patients. Ask them about it.